Violent face-off with China in Ladakh's Galwan. Both sides suffer casualties. Prime Minister attend virtual meeting with chief ministers. Requests people to stand strong and united to fight against COVID. Corona cases on rise in the northeast. Assam tops crossing 4,000 mark. Indian Council of Medical Research contributing to quick detection of maximum COVID cases within shortest time. And COVID recovery rate reaches 52.46%. COVID testing capacity ramped up to 3 lakh. Good evening, viewers. Welcome to the Notice News Bulletin. This is Monjui now with the details. The army today said that one of its officers and 2 soldiers were killed in Ladakh's Galwan Valley yesterday night during a violent face-off with Chinese army. In an official statement, the army said during the de-escalation process underway in the Galwan Valley, both sides suffered casualties. Army said the senior military officials of the 2 sides are currently meeting at the venue to defuse the situation. Defense Minister Rajnath Singh has reviewed the situation at a meeting with External Affairs Minister Dr. S. Jaishankar, Chief of Defense Staff General Bipin Rawat and the 3 service chiefs. In order to improvise COVID situation in the country, Prime Minister Narendra Modi today communicated with the chief ministers of various states and union territories, including Punjab, Assam, Kerala, Tripura, Goa, Manipur and Ladakh. Prime Minister Modi said that all the people of the country should unitedly fight COVID-19 and follow all the given protocols. He even assured that the Indian economy is coming back on track. Modi requested the people to take the advantage of Corona's disadvantages. Tomorrow, Modi will be virtually communicating with chief ministers of other 15 states, including Maharashtra, Tamil Nadu, Gujarat, Delhi, Bihar, Haryana, etc.
प्रयासों से हमारी अर्थव्यवस्था में ग्रीन शूट्स दिखने लगे हैं। पावर कंजम्पशन जो पहले घटता जा रहा था वो अब बढ़ना शुरू हुआ है। हमारी इतनी जनसंख्या होने के बावजूद भारत में कोरोना संक्रमण उस जैसा विनाशकारी प्रभाव नहीं दिखा पाया जो दुनिया के और देशों में कोरोना ने आफत पैदा की है। दुनिया के बड़े बड़े एक्सपर्ट्स, हेल्थ के जानकार लॉकडाउन और भारत के लोगों द्वारा दिखाए गए अनुशासन की आज भारी चर्चा हो रही है। आज भारत में रिकवरी रेट 50% से ऊपर चला गया है। आज भारत दुनिया के उन देशों में अग्रणी है जहां कोरोना संक्रमित मरीजों का जीवन बच रहा है। कोरोना से किसी की भी मृत्यु दुखद है। हमारे लिए किसी एक भारतीय की भी मृत्यु असहज करने देने वाली है। लेकिन ये भी सच है कि आज भारत दुनिया के उन देशों में है जहां कोरोना की वजह से सबसे कम मृत्यु हो रही है।
Along with the entire nation, Northeast have also been affected by coronavirus. In Arunachal Pradesh, the total number of COVID cases rose till 91, among which 7 have recovered. 490 people were affected in Manipur, out of which 151 recovered. 117 people were affected in Mizoram and 1 out of them have recovered till date. 1 person have died in Tripura, along with 1,086 still positive of COVID. 10 new COVID positive cases have been reported in Assam today. 3 from Dhemaji, 3 from Udalguri, 2 from Sonitpur, 1 from Nagaon and 1 from Hojai. The total number of COVID cases in Assam is 4,319. The number of recovered patients are 2,205, whereas 2,103 cases are active COVID cases and 8 patients have died till date. Health Minister of Assam Himanta Biswa Sharma informs that today 10,000 samples were collected and successfully tested. Currently, India records a total of 3,44,527 corona-positive cases till date. The total number of deaths till now has reached 9,924 and 1,80,464 have recovered. The total number of coronavirus cases across the world is 81,47,087. Death toll rose to 4,39,809. The number of recovered patients rose up to 42,55,339. In terms of corona-positive cases, USA is leading in the list, followed by Brazil and Russia. Indian Council of Medical Research, shortly ICMR, has recommended the use of rapid antigen test kits for diagnosis of COVID-19 in containment zones and healthcare settings in combination with the RT-PCR test, which has been developed by a South Korean-based company. The rapid antigen kit is a rapid chromatographic immunoassay for qualitative detection of specific antigens to SARS-CoV-2. ICMR said in an advisory that suspected individuals who test negative for COVID-19 by rapid antigen test should be tested sequentially by RT-PCR to rule out infection, whereas a positive test should be considered as a true positive and does not need reconfirmation by RT-PCR test. The result of this test takes only 15 minutes.
क्या हेल्थ की सुविधा देनी चाहिए इसके बारे में पता चल जाएगा और ये बीमारी पे कंट्रोल लाने के लिए फायदा होगा.
A total of 168 Indian nationals are returning from Maldives today through Air Indian flight destined to Trivandrum and Bengaluru. Passengers had started gathering at Mali airport since morning and thanked Indian government for Vande Bharat mission for evacuation of Indian nationals. Another 2 flights are scheduled in the next 2 days for Delhi, Kolkata and Bhubaneswar. The repatriation is being carried out in coordination with the Indian High Commission in Mali. Maldives has over 20,000 Indian nationals and over 5,000 have registered to return in wake of the COVID crisis. Tripura Education Minister Ratan Lal Nath on Monday has announced the formation of a 32-member committee plus 6 inviters to take decision on reopening of schools. While the minister himself will chair the committee, the Vice Chancellor of Directors of Tripura Central University, TCU, former Education Minister Tapan Chakraborty, all 3 directors of as many wings of the Education Department, 3 directors of as many wings of the Health Department, senior journalist and editor Sanjeev Dev and student representatives of NSUI, SFI and ABVP have also been included in the committee. The 6 invitee members will decide on reopening of all educational institutions of the state. Besides this, he also announced that the results of all school-level examinations will be declared between June 16 and 25th in 3 phases, and the mark sheets will be given to parents as students will not be allowed to come to schools to receive the mark sheets.
In charge, Tripura University, Sri Arunodaya Saha, Vice Chairman, State Higher Education Council, Srimati Nilima Ghosh, Chairperson, Tripura Child Protection, Srimati.
The Union government today said that the COVID-19 recovery rate has reached 52.46% in the country. During the last 24 hours, 10,215 people have recovered from this infection. Presently, the total number of active corona cases in the country is 1,53,178. The Health and Family Welfare Ministry said that 10,667 new cases of COVID-19 were reported in the last 24 hours, taking the total number of cases to 3,43,091 in the country. Meanwhile, the Indian Council of Medical Research (ICMR) said that the total of 1,54,935 tests of coronavirus were conducted by the various laboratories in the country within the last 24 hours. ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, total 907 laboratories across India have been given approval to conduct the test for COVID-19, including 659 government laboratories and 248 private laboratory chains. As the pandemic COVID-19 intensified in the country, it was important that urgent measures needed to be taken on priority to prevent the spread of the virus in the child care institutions, CCIs. Prompt and urgent action was taken by the Social Justice Department to preempt emergency and disaster situation arising with regard to children for state care. The CCIs were instructed to keep adequate soap, hand wash, sanitizer available to the children, not allowing unnecessary outings, restrict visitors, check flu-like symptoms, and coordinate with doctors to carry out medical checkup for COVID-19. The advisory from the Ministry of Women and Child Development to discourage entry of visitors, ensure proper cleaning and frequent sanitation of the homes, particularly of the frequently touched surfaces, and other important safety habits. Along the do's included maintain personal hygiene and physical distancing, washing hands with soap and water. Don'ts included: do not shake hands, do not touch eyes, nose or mouth. COVID-19 has impacted every part of life. The current situation has forced us to rethink our working pattern and try to find more ways for smooth functioning of offices. NIC service platforms certainly play a vital role for developing a rapid network of e-offices in the hilly state Arunachal. A report from our Itanagar correspondent.
Arunachal Pradesh become all the more important due to the well-known challenges in communication infrastructure in the state, especially at remote areas.
It is running 24/7. We have to monitor it all the times. During COVID-19, actually, we have met our operation 24/7. That is already there, but then especially during night time also.
In order to ensure continuity of government services, NIC provides platform for e-office, software support administration under lockdown. During this period, NIC Arunachal has conducted video conferencing totaling about 1500 studio hours. The center has also made available the platform for online ticket booking system for state transport, which enabled the department to run special bus services for stranded people without selling tickets.
NIC is working in the field for quite long, okay, but the COVID has made some changes. We are trying to put web VPN kind of thing so that people can access e-office, which is a most important tool for governance. For COVID management, the IT tools are used. Huge data is coming about affected people, about stranded people. It requires management of them, and we are working on that also with state government.
NIC is working at the forefront to enable continuation of governance despite severe restriction imposed by the pandemic. With Dogin Randa, Sanjay Pratap Singh, DD News, Itanagar.
To end the news, the headlines once again. Violent face-off with China in Ladakh's Galwan. Both sides suffer casualties. Prime Minister attend virtual meeting with chief ministers. Requests people to stand strong and united to fight against COVID. Corona cases on rise in the northeast. Assam tops crossing 4,000 mark. Indian Council of Medical Research contributing to quick detection of maximum COVID cases within shortest time. And COVID recovery rate reaches 52.46%. COVID testing capacity ramped up to 3 lakh. And that brings us to the end of this evening's bulletin. Thank you for tuning in. Namaskar.